Hey, how you guys doing out there? This is the first edition of Run That Back. I have, some special people in the audience with me. Today, our topic is definitely going to be about the coronavirus and, just trying to eradicate some of the things that people are feeling, try to bring some relief to some of your anxieties, talk about some things that are real, and give you some answers to some questions that you may have, and also give you some answers to some things that you have no clue about. And so I'm just really excited to introduce my teammate from Old Dominion University. You couldn't tell me that she was going to be a nurse, the way we started out. But I tell you, she's one of the most brilliant people that I have in my life, and I'm so happy to have reconnected with her. She is a nurse, and during this time of this pandemic, I mean, I was really struggling, going through some things with breathing. And let me tell you something. I know how healthy I am. I'm so glad that I'm in touch with my body and I know how it functions or how it's supposed to be. And with that being said, the things that I was experiencing, I knew that something was wrong. And so before I go on and on and on and get long-winded, I would like to introduce, and she's going to reintroduce herself, Jackie Kenny.
Nice to meet everybody. I don't know if I'm supposed to be on the screen. I can see myself up in the left-hand corner. So like Adrian said, we are teammates. A little bit about me. I started out as a social worker. So I was going to save the world a little bit differently. And so, yeah, I have been an ER nurse for most of my career. I've done a little bit of home health care nursing, wound care nursing, psychiatric nursing. But most of my nursing career has been in the emergency department. I'm in a very city busy hospital outside of Atlanta. I'm back in school, and I'm about 7 months away from my nurse practitioner. So I'm very honored to be part of this show, and just the kind words from Adrian are appreciated. So hopefully I can answer some questions and put some anxieties to ease, and just give you guys a lot of good information about the coronavirus. And it's just great to be here, part of the show.
Absolutely, man. You've helped me so much, and just to cross that bridge, because you know how I was panicking, and I'm like, listen, I was a great candidate for walking around with that shirt that says I can't breathe.
Yeah.
And, just the mixture of things that you told me to do, from the medicines that the doctors had to prescribe to me and telling me what works well with that, on a homeopathic tip. It wasn't, you trying to, tell me what type of medications to take, but you were giving me good information about the medicine that I was taking and what would complement it to get me over the edge. And when you did that, like I said, the things that I coughed out of my body the last 2 days, it scared the crap out of me. I was like, oh my God, I definitely got this thing. My parents, I'm bugging out. I'm walking around the house with a mask on, trying to take care of them, because I don't want to compromise their health. Two cases of COPD, 2 cases of high blood pressure, one case of neuropathy. So, that spells disaster when Corona gets involved with that. And, I'm a candidate of telling you that this thing is tricky. It doesn't show its face. I had an x-ray, and my chest was totally clear in the hospital. On the x-rays, I saw it, but I knew something was inside of me.
Yeah.
Before, like I said, I can go on and on, but I also have another guest of mine, and it's my little nephew, so to speak. He's also, we got all ODU on here. Okay. Vid, I tell you, he published my book. And we've had a long journey. He's played basketball. He's in great shape. He mentors kids. He writes books. Vid, introduce yourself.
Hello, everyone. I'm Vid Lamonte Buzz Jr., athlete, author, entrepreneur. And what I'm about is uplifting everyone, especially the youth. And Adrian has been a mentor to me for years, and I look up to her. And for me, I have kids. So when she told me about this opportunity, I had to jump on because I have some questions and fears as a parent, as do all parents. So I don't think you can be in shape and be healthy, but no one's too healthy. And so,
Amen.
Yeah, that's the truth.
Exactly. So, Jackie, we touched on so many things. I mean, I feel like I'm like I know this virus. Like I'm personal with this virus. I'm coming for you. Nah, you're not taking any more people out here. God bless. God bless all the people that have perished. I mean, we buried an uncle of mine today, and I'm sitting with my mother this morning, watching it on via Facebook.
Yeah.
This is where we're at because only 10 people could be at the funeral.
Yeah.
And they had to be six feet apart, which is difficult. You got my aunt who's 90 years old and she's mourning. She needs somebody to hold her up. So, there's violations on that 6 feet everywhere. When you're mourning, all of that kind of stuff goes out the window. So, let's start out with the personality of this virus.
Yeah, I mean, I think that's a good place to start because, there's a lot of fear, a lot of panic, a lot of anxiety because it's what we have termed a novel coronavirus. Okay, novel being that it's brand new. We've not seen this strain of the COVID-19 coronavirus before. But the coronaviruses are not new to us as human beings. They've been around for years. Okay, chances are every one of us on this call have been impacted by a coronavirus at some point, better known as the common cold, upper respiratory infection. They're the culprits for causing most of upper respiratory infections, common cold. So what makes this one so different? Well, it kind of mimics some of the older viruses that we knew back in the early 2000s, the SARS virus. And now we're looking at the COVID-19 virus. So I think Dom sent me one of the questions, and I have the questions pulled up here. Let me just scroll up here. He asked about some good questions about the CDC. Like, how does the CDC determine when virus numbers peak? And so we'll look at that. So one of the things we know about the coronavirus, right, it started over in China. We don't know, is Wuhan ground zero for the coronavirus? Well, we know what the media tells us, but we know it originated over there. Okay, so what makes this virus different? So Adrian, you said, I had an x-ray of my lungs. My lungs were very clear. So we know that this virus presents differently in different people. So the first outbreak over in China showed us different symptoms than what we're seeing in the United States, and even different symptoms than what we've seen in Italy and even parts of our own country. Okay, so we know that this was an imported case. Imported means that somebody traveled over here, they came in through one of our cities, and they brought that virus over, whether it was a Chinese person that lived over in China, whether it was somebody that traveled abroad and came back. That's how things sort of jump demographic lines and jump countries. So it gets introduced into the United States, and we look at these cities now that are hotspots. Okay, we look at New York, we look at the San Francisco Bay Area, we look at Seattle. And so if you're watching this virus, we've all heard those cities, right, as hotspots. So those cities tend to be lighting up, and everybody's kind of got their eyes on those cities going, hey, are we going to be like that? Is this going to happen here? What does the CDC say? And when will our peak times come? So we look at the Seattle and San Francisco Bay Area, and the CDC is going to look at a few things in trying to determine what's coming globally, one, but what is coming more importantly throughout the United States? How will this sweep across state lines, city lines, and ultimately down to our personal cities, because that's what we really want to know. How is this going to impact me personally, the people that I love? So we use something called computational epidemiologists that sit and they just look at this data and they look at how things spread, and they look at a couple different things. So we look at, first of all, the peak times generally will not peak at the same point. So New Jersey, Bayonne may peak at a different time than, say, Winnipeg, Wisconsin. Okay, and here's why. When you get into those small rural areas, like where I'm from, some of my family is in rural Ohio. We're not as densely populated. We're not packed together like New York is, okay? Mm-hmm. Maybe like a 3-mile stretch of Bayonne, you guys are on a small peninsula. And so we may see different peak times. We might see different infection rates in cities, because as we look at the age of populations, right? So let's talk about Italy, and we'll jump back to the United States. So I'll try not to jump too much. When we look at Italy, what did we know about Italy? We knew that Italy was one of the oldest population countries around, right? They had the greatest number of people over the age of 65. And so everybody kind of freaked out, and they were like, wow, everybody's dying in Italy. But we know that the elderly people were not faring as well. And so the other things that we look at age, we look at the health of the population, we look at the proximity of people. What is the dense population of an area, and how proximal are people to one another, right? We look at regions. What regions are people closest to? So if we go back to the Seattle and the San Francisco Bay Area, we know that their ties to Asian countries are a whole lot deeper than anywhere else in the United States. So they have the risk of more people importing cases of the coronavirus into those areas because of their ties to Asia, because of some of those countries that are impacted. Wow. So those computational epidemiologists are looking at this information. This is kind of what they're studying. So they're looking at all this information and other things that go into that, those peak times and infection rates, and, why is New York this way? And what about Seattle? And what about the San Fran Bay Area? Well, there are reasons why that's happening. And so we don't really even have to speak out loud to New York's problems, but we will. So when you look at New York and you look at the dense population of that state.
Absolutely.
Yeah, those people, Adrian, you brought up a point. Those people travel. New Yorkers use public transport everywhere they go. They order out their food everywhere New Yorkers go. They are in densely populated, packed areas, okay? We also know that New York is a hub for a lot of different cultures. There's a huge Asian population in New York. A lot of travel goes on through New York. People are flying in and out, one of the busiest airports. Right. And so as we see those factors and those elements come into play with infection rates, we start to see these cities lighting up as hotspots. So, there's not an easy question to answer when the CDC says, this is when this time will peak or this time will peak. So you might have seen some information where the directors of the CDC or the WHO say, it looks like the states are sort of traveling along at the same rate. Uh-huh. But that can change because, there's so many things that go into that, cases that people that haven't shown symptoms yet.
Absolutely.
Right. So Adrian you could have been walking around with the virus, okay, early on, not really showing those classic symptomologies, but now you're coming into contact with people before we really knew, and we're sort of infecting people, right? And so there's going to be a populace that does not show classic symptomology of the COVID-19. So they can be carriers, right? So those are the ones that are kind of scary. Okay, there are other elements with the infection rates and peak levels, like when will Georgia peak versus when will Bayonne peak? That can look very different. And there are things that we just can't predict. We like to track the infiltration rates in the United States, but there are a couple factors too that we have to look at. There's flawed dissemination of information. Okay, so we're not getting accurate results because of testing. So most people across the United States still can't get tested. Okay, so let's say, Adrian and I had a conversation.
I'm going to elaborate on that one.
Yeah, you go ahead. Please jump in.
Let me tell you something.
Yeah.
I had so many people go, oh, I can't get tested. Let me tell you how I bullied my way into this test. Okay, and because I would not be denied. It's like, I use my parents as a reason I had to have this test. I'm a teacher.
Yeah.
Okay. I teach public school, and then, they already know that, the whole NBA story. So when I shared with them that, hey, listen, the NBA sent me, it was a totally different story. Now, not everybody's going to have that, but even if I didn't have that, there's other factors that you can use, especially if you're with elderly parents. Yeah. So, I mean, you just have to, you have to at least try, you have to at least try, at least pick up the phone and say, hey, listen, I got elderly parents. I need for this to happen, and I'm a teacher and I work in the school system and I think that I was exposed and this, that, and the third. No, I wasn't showing signs and symptoms. I didn't have a high fever. I'm asymptomatic to a lot of stuff. Even as a kid, I never ran a high fever whenever I got sick. So I just like I'm saying, I know my body. I know my body. And that leads me right to the next question that we're going to talk about, because when we talked about this, you blew my mind, and I kept sending you that emoji with my head blowing off because you kept blowing my head off. And, when you were talking about how the DNA, okay, it attacks different cultures differently. It attacks every single person differently, according to your DNA. So I could be married and me and my husband have the coronavirus. Okay. I'm sitting here, I'm knocked out in the bed. I can't move with body aches and he can't breathe.
Right.
So it affects people differently. Elaborate on that and the difference in the cultures and how it affects people differently.
Yeah, so that's a great segue into trying to understand this virus. So, so we'll talk about how does the virus really enter into a person's system. So obviously we breathe it in. You either breathe it in, you touch something, you touch your face, you touch your nose, you touch your mouth. It's droplets in the air. We've gone back and forth with the CDC, the WHO, about, hey, do we need N95 masks? Do we need regular masks? Do we not need a mask at all? And there, there's a lot of speculation. So information has come out differently where, initially it was that the droplets are bigger, so they only travel 6 feet and then they drop. That's why we have that 6 feet or greater. So in any event, it enters through your respiratory system, through your nose, through your mouth. So it likes to get there to the back of your throat, likes to sit there. So that's why we see the symptom of sore throat. So that's generally been a pretty consistent symptom, regardless of culture, class, whether you're Irish American, Italian American, Black American. That we see symptoms that are pretty classic across the board. So we know that coronavirus is going to get into the back of your throat, likes to sit there, and their first complaint will be, I've got sort of a sore throat. My throat's uncomfortable. What that virus likes to do, and this is going to be interesting. So it's an RNA virus. It has these spiky proteins on the outside of it. Everybody's seen the picture of the big nasty corona virus. It's got those spiky proteins. So what it does is it sits there and eventually it works its way down your throat into your upper respiratory tract. Okay, so here's what's different about the COVID-19 virus. So the COVID-19 virus is an invader. So what it does, it invades your healthy cells. It hits your cells, it attaches those spiky proteins to your epithelial cells of your respiratory tract, and it invades that cell. What it does, it gets in there, it takes over the cell. Sometimes it kills cells. Okay, so why do we see this cough and difficulty breathing and shortness of breath? there's one thing that this COVID-19 virus likes. It attaches to what we call an ACE2 receptor. ACE2 receptor. Now this is really scientific, but I'm trying to stay away from it. But ACE2 receptor means angiotensin converting enzyme 2 receptor. They're in the bottom. They're primarily more numerous in the lower half of your lung tissue, the epithelial tissues of your lung cells, okay? COVID-19, for whatever reason, likes those receptors. It attaches to those receptors. So one paramount clinical picture that we see with everybody, we see lower lobe infiltrates first because it likes those receptors, and the abundance of those receptors sit lower in the lungs. Okay, so if that makes sense, it's like
Yeah.
yeah, it's like
Makes a lot of sense.
yeah, it's like going to a car dealership, you know, and all the small compact cars are up front. But your preference is for the big SUVs way in the back. So where are we typically going to find, you know, Adrienne? We're going to find her way in the back where she prefers the bigger cars. It's same with the COVID-19. I know that's a very rudimentary example, but that's kind of how the COVID-19 virus invades those lungs. So it takes over the cell, it replicates its RNA, and we'll talk about what zinc does to the RNA replication.
Yeah,
And we'll do
absolutely.
that. So it likes the human airway epithelial cells, same with the SARS virus, the old SARS virus back in the early 2000s. So what happens, it gets down there and inflames those epithelial. It causes inflammation. Inflammation, you know, gets down to the alveolar sacs, so the tiny air sacs where your gas exchange happens. And this is probably why you had some of your difficulty breathing. So once those tiny sacs get inflamed, those sacs are what help to expel debris. So it kicks out debris and mucus and dead cells. So as that COVID-19 virus is killing cells and all that debris is getting gathered down there, it overwhelms your lungs too quickly, where those tiny sacs can't do their job and expel all the debris and mucus. So then we have a buildup, an accumulation of all that debris. Sometimes it goes into pneumonia. So we're seeing pneumonia, generally bilateral pneumonia. And I think Dom asked this question. He said, can you have the flu or pneumonia and have COVID-19 on top of it? So the short answer to that is yes. In particular, we see a lot of pneumonia with COVID-19 because of what I just explained to you, of those tiny sacs and the inflammation and all that going on as the virus replicates in the cells and debris is being created and those sacs can't force it out. So typically we see that bilateral pneumonia. It acts a little bit different than typical pneumonias that we see. Because usually some pneumonias that aren't COVID-19 driven impact a certain area of the lung. We don't typically see it dispersed as equally as we do with the COVID-19 virus.
Okay, so when you, for us average Joe Schmoes who have no idea what you're speaking about when you say bilaterally, could you elaborate on that for us? You know,
I apologize. So yes, bilateral means both sides, evenly on both sides.
Okay.
So we typically see a lot of the COVID patients that are the severe cases. So, and we'll talk about that. So know that there are a lot of people that are recovering from the COVID-19 virus. We're going to talk about some of the things that I see in the hospital, and I talk to my doctor colleagues and pulmonologists who see this, and so we go, well, what's really happened? Are people recovering? So the long and the short is yes. And there are some disease states that have the propensity to have worse clinical outcomes. Okay. And I don't think that the CDC or the news has shied away from telling people what that population is. So we look at people that have cardiovascular disease, okay, heart disease, heart problems. Diabetics aren't faring too well through this. Okay?
Yeah.
You know, and that multi-level issue that could be another topic for people that have diabetes and how they protect themselves with that.
Absolutely.
Yeah, and we also know that, again, aged people over the age of 65, a lot of the deaths that we have sort of witnessed, and even if you do the research and look at the numbers, are occurring in older people. And that, again, that's multifaceted. That's for many, many reasons. And we look at state by state. So we look at Oklahoma, Alabama, Mississippi. When we talk about those 3 states, we know that they have a higher heart disease. Those states are higher heart disease. And so we may see more deaths out of those states. When you talk about Puerto Rico, Florida, Maine, more aged populations, they have the greatest populations over the age of 65. So when it's all said and done and we have the ability to test, we may see more deaths out of specific areas, which is not uncommon.
Okay. And
yeah.
that's good to elaborate on, because when you're looking at it and you look at it at face value and how they're blasting it on TV, and that's why I don't even watch TV, because it's depressing. It gives you anxiety. Right now I've just been finding things that I can do to work on myself, to better myself, because I plan on surviving through this whole thing. Yeah. And so, what can I do to get better in certain areas and focus on that, because the television is putting so much information out there. It's easy to get confused. And that's the reason why I wanted to have this call, so that you can elaborate on that, because that was a valid point that, these different states where you're seeing all of this death, and all this mortality, the mortality rates are like crazy. Yeah. It's because of the fact that they have more elderly people, or they have more people that are suffering from heart disease, or they have more people that are suffering from diabetes, and all of the areas that it's attacking. People that have respiratory disease, COPD, high blood pressure, it's even getting at that, So that was great for you to elaborate, which leads right into the next question. And then after that, I'm going to allow you to ask something, because I know that you're taking it all in. It's probably blowing your mind back there. I was waiting to see an emoji come flying through here with a blown head off, because this information is just fantastic, and it gives me clarity. It gives me more confidence when I go out into the world. I know that if I'm putting the right things in my body, and I go outside with the coat of armor, and when I come home, I'm following the steps, and we're going to go over this too. I'm following the steps that I need to before I even bring my behind in the house. Okay. So the next thing I wanted to talk about, and this is bothering me, and there was only one establishment. No, actually, there's been 2 establishments that I have been in. Okay. In Bayonne, where no mask, no service, okay? And that's GNC on the back highway, and then Walgreens started it, all right? No mask, you can't come in the store. And it's a great policy. I don't care if you have a bandana on your face. You got to cover up, man. No, maybe it won't protect you completely, but at least it'll protect somebody else. So should people walk around with masks on their face, Jackie?
So, yeah, I'm going to put this out there because I am a frontline worker. I see firsthand the true nature. I see I absolutely see the true nature of the beast that we're dealing with.
Yeah, to all the way to FaceTiming, and that was a horrible story you told me. Yeah. Where you didn't want the woman to die alone, so you FaceTime this woman, with her daughter, so that her daughter could say bye to her via Facebook.
Yeah, and there are hospitals around the country that are doing this.
FaceTime, excuse me.
There are family members not at the bedside. There are people that are dying alone, and so for the people that, I talked to a neighbor today. We were talking about hand washing. Okay, and using alcohol-based hand sanitizer when you're outside of your home. And his statement to me was, it's not going to work, it's an antibacterial. That's not true. It's an antibacterial, but what he doesn't understand, and what the research shows, is that alcohol-based hand sanitizers will kill just about all of the nasty bugs that are out there. The exception being C. diff. We treat C. diff differently. That's another topic. But trying to speak to just the ignorance in a person is very difficult. It'll drive you absolutely insane. So you do what you can do to protect yourself. Your family members. And so I will say this, yes, I believe that people should be in masks. You know, everybody is hand stitching masks. Hand stitched masks are fine. This right here, I'm going to take this off and show you. So I am going to put to rest some and clarify some things. This right here is the N95 mask, okay? So my work gives these out. This is one of my own personal ones. Does everybody need an N95 mask? No, you don't have to walk around in an N95 mask. Here's why. Unless you are in a room, you're doing CPR, you're intubating somebody, it's not going to be aerosolized like it is when you're in the hospital. However, I would never discourage somebody who has an N95 mask from wearing one. Right. If you're in, it's not going to hurt anything. You know, it's preventative. And what I would like to see our medicine do more of, I hope this teaches us a lesson, is become more preventative and not reactionary. I don't want to see you come to the hospital and now I treat you because you have the disease. I want to teach you how to prevent getting it.
Absolutely.
And so using a mask, absolutely fine. Cover up, do whatever, because, you know, how many times are you in a store and a cough comes on and you just cough? Look, if I'm standing 6 feet from you or 7 feet from you, guess what? I'm breathing what you're breathing. I'm taking in what's coming out of you.
Absolutely.
If you have hand sanitizer, carry it with you. You don't need, so I'm going to do a demonstration. This hand sanitizer, okay? Carry it with you. This is all you need. Can you guys see that? It's not even a P shape, okay? 20 seconds. Here, back of your hands. Hit every portion of your hand, interlock your fingers, okay, around your thumbs, just like that. You've hit every portion 20 seconds with the hand sanitizer. When you're out, before you touch doorknobs, after you touch stuff in the grocery store, sanitize your hands. Sanitize your hands, wash your hands. After every 3 or 4 applications of this alcohol base, you have to wash your hands. Okay, you can't just go 10, 12 times and just use that.
Yeah, absolutely.
Yeah, wash your hands. You know, I'm not going to discourage anybody's personal practices. If you bring packages in and you feel comfortable wiping down your groceries because you have people in your home, I'm never going to discourage people from doing that. Is it a practice that I personally do myself? I don't wipe my groceries down, but if I handle packages and I handle things, I make sure after I put the groceries away that we talked about the Clorox bleach solution. We talked about the Lysol. I wipe my countertops. I go through my house. I wipe my doorknobs. The virus like metal hard surfaces better than it does, say, clothing, cardboard. You know,
what about wood?
From what I'm reading, the research says it tends to stay on hard surfaces a bit longer. So, you know, in your own house, if you're prudent about washing your hands and things like that, I don't want to say you're not going to pick it up, but you're more likely to get it if you're out and about.
Yeah, absolutely. You know, and that's the truth. And, you know, that's just breaking down some anxieties that we have, you know, can't, you know, like every 5 minutes, you know, you're going around the house with alcohol, you know, it's just, you know, I do that, you know, when as soon as I come in and out of the house, I make sure I go right to doing a knob, because it's easy to forget. It's easy to forget. So it's easier just to have a routine. Like in my house, me, my mother, my father, we have such a fantastic routine. Now, did this routine just all of a sudden happen? No, there was a lot of arguing around this routine. There was a lot of breaking bad habits. Listen, you guys have got to get better because, right, it's coming for you guys. It's not really coming for me. It's coming for y'all. You're 70, you're 75. It's looking for those types of people.
Yeah.
Anybody over 65, and you know what, 60, I'd be cautious because if you're not healthy, then yeah, it's coming for you too. So, like, with that being said, it was okay. We got to do the doorknobs. We got, you know how many times my father goes in this damn refrigerator? So it's like, you go outside, you come in, you go in the refrigerator, you go in the front, you go take out the garbage, you come in, you go in the refrigerator, blah, blah, blah. So all of these things, I'm saying, listen, you're touching the garbage can. These dudes are, you know what I'm saying? So
yeah.
It was a battle. But now, here it is. My car pulls up in that driveway. My mom and my father gets up. He meets me at the back door. I come in, like they leave the cart out front.
Yeah.
I take the groceries and put them in the cart. Bring them in the backyard. Okay. Put it on the table.
Yep.
Okay. He comes out. We got rags.
That's it.
We wiping down all of the food, and then we're bringing it in the house because somebody in Walmart went
exactly
on the bread.
Exactly right.
You can't see it. So there's so many irresponsible people out here that don't have, that don't care about this thing because they think that they're Superman. But even Superman had kryptonite.
That's right.
So there's something out there for everybody. There's a weakness for everybody. So we have a system. Now I don't find myself fighting with my parents about this stainless steel table I'm sitting at right now, or the stainless steel refrigerator, or the doorknob. I'm not arguing with them now because the more that I come in here with information and the more that I kept on them, and then I'm talking to you and I'm coming back with viable information from people, then now they're starting to go, hey, listen, let's start to, it's easier to just go along with the flow than to be out here trying to go against the grain. And so, I really, really appreciate that. Vid, come on and ask some questions because I know you have kids and you have some legitimate concerns.
I want to speak to. He asked me about kids. Why are kids less affected? And I want to talk to that. So the American Academy of Pediatrics did a study. So one thing I want to say to people is, medicine moves quickly. We have super intelligent medical professionals in this country that are doing nothing but studying this virus. I want people to hear and to know that we do understand this virus. The literature, it's moving quickly, but we're moving as quickly as this virus. People are doing nothing but studying. We're changing how we treat this, our interventions, our medical handling of the virus. And it's not like we're just flying blindly, because we are not. And we're doing great work in the hospitals. These exceptions, and I don't want to say that New York and Seattle, San Francisco, that they're the exceptions, because they're not. I don't want to panic people. I want to bring both sides of being so lackadaisical and so panicked. I want to bring those two together.
Absolutely.
And build a bridge of knowledge and wisdom where we are prudent and we practice our social distancing. We take care of what we need to take care of to prevent the spread of this disease, wearing masks, wiping your groceries, doing the things that you need to do to protect your circle right now until because we will have a vaccination. We will know how to treat this. And it's, it's just a matter of time. But I needed to say that. But I'm going to go to the American College of Pediatrics that did a study. So they looked at 2,143 kids affected by the COVID-19 virus. These were kids out of China. Okay, 731 of those kids were lab tested positive, meaning they were definitively positive. 1,412 of those children were considered what we call persons under investigations or suspected COVID. Okay, so I'm going to give you some statistics, because you need to fact check your information. fact check me too. You know, don't just swallow down information because it comes from a professional, because we're right. We practice medicine. We say practice for a reason because we're learning too. 90% of those kids affected were what we call asymptomatic. 13% of those kids diagnosed showed no signs and symptoms. This research study is going to be available in the AAP as of June 2020, so you can read this research. But most of those kids had a very mild form of this disease. Like less than 6% of those 731 that were positive, but the whole group, less than 6% had a severe case. And of those cases, only one child died. Okay. So we kind of look at that and go, right, we scratch our head and go, what is it about the kids? And really the long of the short of this is that we don't know precisely why. Dr. Maldonado, who is the chairperson of the American Academy of Pediatrics, had some things to say. She's doctor. She's was part of this study. She thinks that it could have something to do with the young immune system of children, and that immune system is still evolving, okay? Meaning that they haven't been exposed to as many of the coronaviruses as we have been exposed to. And so when they mount their immune response, it's not as overzealous as ours. And I won't go down this rabbit hole, but I was trying to explain to Adrienne, there's something that happens in adults that's called a cytokine storm, because our immune systems respond so aggressively, and sometimes that works against us, if that makes sense. It's like, yeah. And so Dr. Maldonado is saying, we don't really know, but it might have something to do with the ever-evolving, young, youthful
absolutely
base of the child's immune system, right? So so that 6% is compared to nearly 19% of adults that have a severe case. And so they're constantly researching and studying, because part of that is we need to look at the children's immune system. How do we mimic that? How do we tap into that so we can treat the adult population, right? Because we always look at that in medicine. So we know that certain populations, Adrienne talked about this before, talked about the Italians, and there was some research that came out about a thalassemia, a trait that they have that might have made their course of illness more severe. We know that back when H1N1 came out, right, pregnant women were hit harder with the H1N1 than most other populations. We're not really seeing pregnant women hit as hard with the COVID-19 virus. And so there are these things, right? Wow. Way back in the beginning when we started, I said, there are elements that we just cannot account for. We can't predict, we don't understand it yet.
Yeah. And this leads me right to this next question.
Yeah.
I know that you say that, kids are more immune to it, but they can get it, right?
They can get it.
Okay.
So milder course. Mm-hmm. A lot of them tend to be asymptomatic. So here's the tricky thing.
Exactly. And that's where I was going with exactly. Okay. Now, here in Bayonne, it's like people think that their kid can't get it. And I see so many kids walking around with a mask. Without a mask on. Now, that kid can get it. They're asymptomatic. Nobody knows that they have it, and they're around grandma. Oh, kids don't get it. Okay. Now, the kid can be affected, and they affect an adult, and then now it's still out there. And so this is my issue. I think that everybody should have a mask on, regardless.
That's right.
Until we are vaccinated, everybody should have to wear a mask. And I don't care if they're saying, oh, kids are immune to it and they're less susceptible to it. I'm asymptomatic to a lot of things.
That's right.
So and me knowing that, my parents are right in the other room.
Kids are not immune. So there's a difference between immunity. We're really not immune to anything, right? So
exactly.
For 18 years since I've been a nurse, I've taken the flu vaccination every year. I'm not immune to the flu. I've developed an immunity. Okay, so kids have not developed an immunity to the coronavirus. However, what will present in the younger children may present like the common cold. They may have a very mild case, right? So what? Cough, sore throat. Kids are like little petri discs. How many times a year does your kid have a cough, sore throat, runny nose, doesn't feel good?
Absolutely.
But in 2 days, what are they up? They're up playing, right? Out
Yep.
with the kids. So that's what we're seeing here. And I gave you those statistics earlier because I said 90% are asymptomatic. 13 showed no signs at all. So what does that mean? How many grandparents and older people are caregivers for their grandchildren?
That's what I'm saying. Exactly.
Have to guard against that because, you know, we don't know because you have the kids that are sort of not really showing, but yes, they can get it. But what the research is saying, what we're seeing in other countries and here is that the very mild form, and I can tell you this, I've seen very few kids come through our hospital presenting the symptoms that we're seeing in adults. And that's a good thing. You know, to me, that's a blessing. I'm like, you know what? Thank you, Jesus, for that protection. You
Yeah,
know, I
absolutely.
can imagine being at the bedside of kids dying like we're seeing some of the severe cases. So having said that, yeah, you know, they're making all kind of superhero masks. If you got a kid, doesn't hurt to put a mask on them when they're outside, going to the store. If they're going to be around people, yeah, definitely.
Playing outside, all of that stuff.
So,
So,
can I,
go ahead, Vic.
because I know you was about to talk about playing outside. So I'm in Florida, and this kind of, first of all, you answered all the questions I've had so far.
Good.
I'm just in shock. But this being in Florida, we're a different beast. I'm in the Tampa Bay area.
Yeah.
And so just with, let's say 2 weeks ago, Tampa itself initiated the Safer at Home before the state did.
Good.
What Safer at Home means down here is non-essential businesses are closed, but basically you can almost do anything, the things you're doing, walking, biking, running, blading, taking the dogs out, yada, yada, yada. And I was one of those people, bike riding and everything, and you would see so many people in the parks, not practicing social distance. We talk about the kids. And just yesterday, Tampa or the Hillsborough County initiated a curfew, whereas Manatee County, which is the county over, that's where my child and her mother lives, they had that curfew in place 2 weeks ago, right? And my question, so leading up to this, it's maybe it's myth, I don't know. Down here, a lot of us have heard that hot and humid weather does something to the virus. Can you speak on that or no?
You know, I can. Again, I know that I always go back to some research because that's what we have to fall back on in medicine. You know, so we can look at really hot climates like over in Africa. So we haven't seen the first outbreak over in Africa until just recently. And so we know that they're getting ready to come up on their more milder season. There is, so knowing how viruses act, all other viruses, so there is a thought that at 140 degrees, the virus will denature. It will have an impact on the virus to kill it. And so we see that with autoclaving. There's some research out that says healthcare workers, you can hang your masks in your car, seal up the windows, set it in the sun if it's warmer in your area. But there's no real research out yet that says warmer climates will not be affected by the virus. Okay, so that includes Florida. You know, I live in one of the hottest climates too, down here in Georgia. We had a very mild winter. You know, our temperatures tend to stay pretty warm, not like Florida, but, you know, back in December, we had some cold days, but for the most part, we've seen a very mild winter and our numbers have not been changed. So there has not been any definitive data out So right now that's, we talked about flawed information. Okay. So when we're tracking epidemiology, computational epidemiology, which means when we're looking at the face of this disease and what we think it's going to do, right? That's part of the elements that we can't account for, is that flawed information. You get somebody that says it gets on social media and people run with it. Oh, we don't got to worry in Florida because it's hot here. Nothing can live in it. Viruses don't typically like it warm, but it doesn't mean that it can't sustain itself in heat. Because here's what you got to think. You're its host. You're how it lives. So the heat down there doesn't really matter at this point. And so to sort of take that as a blanket statement and run with that, and people in Florida think they can just be out doing whatever they want to do, that's a real dangerous place for Florida to be. And so we try to predict and anticipate the path of outbreak and infection and how severe, based on those things we talked about, where it's going, how severe will it be. And we know that Florida at any given time, any state can become a hotspot. Okay, which means there's this lag between people being exposed and when the symptoms catch up, and now we see the disease come full circle where people are actually having the outbreak. And so, I think right now to say the heat is a driving factor of virility, of how potent this virus is a dangerous place to be for anybody.
Absolutely. Absolutely. And, I just appreciate you so much. We're in the stages of wrapping it up, but let's get to some positive things that people can do. I heard that and it was probably through you, that the virus ranges from 5.5 to 8.5 PhD.
The pH.
pH. It's not PhD. pH balance.
Yes. So it can swing in between being
those two.
Yeah. Most viruses like an acidic environment.
Okay. So bottom line is, okay, here I am right here with this. I've been drinking this for probably the last 4 days, which has really been making a difference in my life. I'll tell you, because I have really started on this high alkaline diet, and it's really been changing. And, pushing. The only thing that is on this list that I haven't had is dandelion. I don't even know if it's dandelion root or I gotta go. I didn't even touch that because I don't even know nothing about that. The only thing I know about dandelion is the tea. The dandelion tea is awesome. Yep. But go out to the store, get yourself some avocado. The pH balance in that is like 15. I eat garlic all the time. Yep. Pineapple, lemon, orange, mango, tangerines, lime. I didn't even know graham crackers was high in had a high pH balance. Come on, kid. I have been doing my research here. Nurse Jackie got me going.
That's right.
Asparagus, kale, hitting the 1,000 milligrams of vitamin C. This is my best friend anyway. Okay, the Zicam. I found out that it's in a spray.
Yep.
In the back of your throat. Then you got this one right here. You got pow. Put that up in your nose. My father, he loves this. He going in on it. Oh God, that makes my nose feel good. He's got like a little polyp kind of sore that he's been dealing with up in his nose. He's like, oh my God, my nose. Thank God, because this finger, you've been giving this finger some damn work. Leave that nose alone. You know what I'm saying? So now instead of putting his finger up in there, he's going pow. He loves it, and he loves the menthol part of it. So like everybody's in training in this house, and I love it. That my parents have never listened to me so much, and I love it. Not saying that I want stuff like this to come around. But talk to us about this zinc, Jackie, and we'll wrap it up with the zinc and some of the things that we really can do. The vitamin C, you got me taking this Zysol. And,
to preface this with this statement. Remember, too much of a good thing
could be bad.
And so be very mindful of how you use supplements. If you have any healthcare conditions, you want to
absolutely
make sure that you run it by your
Your
NP,
doctor.
doctor, whoever is overseeing your care. So we'll talk about zinc. So again, we're going to talk about research. The Leiden Medical Research Group did a study on zinc. Okay, in particular, they did a study on cold ease. Everybody knows cold ease, right? Zinc lozenges. Your dad hates them. So 13.3 milligrams of zinc in each one of those lozenges. Okay, so why do the lozenges work better? Because you can take that zinc, throw it right to the back of your throat, and what some anecdotal research has said, and these have been research studies where they've looked at people with the common cold, common coronaviruses, is that 13.3 milligram of that zinc in a lozenge form sitting at the back of your throat, Zicam spray, what that does is it throws a wrench into the RNA synthesis of the COVID virus. So what they're saying is that when those little protein spikies are trying to attach to that human epithelial cell of the lungs in the back of your throat to work its way down, that zinc throws a wrench into that RNA synthesis. Okay.
You better go.
Yeah. So is it preventative? Research doesn't really tell us preventative. Okay. Can it help? Absolutely. Can it lessen? Can it maybe reduce the travel of it? Okay. So here's the caveat. That 13.3 milligrams in that lozenge form don't exceed 150 milligrams a day. Okay, so you want to watch your guidelines. You want to watch where your cutoff points are. The zinc form in a lozenge is different than taking it sort of in a vitamin. Okay, so there's
absolutely, because you go to the store now and you can't find vitamin C 1,000 milligrams, and if you do, they're charging you $26 for it.
Price gouging.
You can't find zinc anywhere. Like everybody is wiped out. GNC were like, listen, we haven't had zinc for a month. And then the new thing that you told me that came out, it begins with the NAC. I went to the store. They don't even have that in there. So people are going crazy because once they hear something, now all of a sudden you run out trying to self-medicate yourself, and that's not the solution.
You don't need to buy 6. If you buy one, you leave some for your brother and sister. You leave some for other people because look, you are only as healthy as I am. If I'm dying and you're dying, everybody else is dying, but only 50% over here has enough zinc. Eventually, they're going to run out, and guess what's going to happen? So I try to tell people, just take what you need. We are not in an apocalypse. We're buying it faster than we can.
Toilet paper, paper towels. Where the hell are you guys going?
Well, this is
it's like some crazy spring cleaning out here, dude.
The coronavirus is never. There are a small percentage that will come with
diarrhea.
You will not shit yourself to death. I promise. It's not gonna happen.
It's just not. But maybe that there's a lot of butts in the house. You know what I mean? So everybody, I don't know. The whole toilet paper thing is just crazy to me. I can see the paper towels because people are just constantly wiping stuff down, and so I get that. You know what I mean? But it's just crazy out of control, and like I said.
So zinc gluconate. Zinc gluconate is what's in the lozenge. That's the best form. Sits in the back of your throat. No more than 6. Watch the 150 limit. So limit cutoff. Acetylcysteine. Acetylcysteine is a supplement. So when you take acetylcysteine, it's broken down into a byproduct, into the granddaddy of antioxidants called glutathione. Okay, glutathione is
I got that one too.
Yeah, it's a very powerful. It's a very powerful antioxidant. Okay, so you can get this naturally though. You can get acetylcysteine from pork chops, chicken breast, tuna. Yep.
Pork chops.
Listen,
like people, that's not going to go over well with Muslims. So you have to present something else.
Chicken breast, tuna, lentils, eggs, oatmeal, sunflower seeds, all that stuff has acetylcysteine in it. So you can get it naturally.
My mom eats oatmeal every morning.
There you go.
She's old school. These old school people, they know how to fight stuff off, boy. You know how when we were growing up, You know, our parents, you got a cut, you got something, go put some Tussin on it. Tussin was for everything.
Mercurochrome. You
Oh
know
God,
that pink stuff.
please. How many of us were running from the red stuff? Jesus, listen, I'm under the bed. Don't put the red stuff on me, please.
Or
So,
iodine. How much iodine did you get put in?
you know, just simple stuff. We so complex, but my thing is my concern is like how many milligrams of things, like you covered it with the zinc lozenge. That's awesome. Yeah. You know, the vitamin C, everybody already knows it's 1,000 milligrams every single day. You know, with the glutathione, you know, I got 500 milligrams sitting up there.
People need to be careful with vitamin C. Here's why.
Yeah.
Vitamin C, what you don't use, you're going to pee out. And elderly people are already at risk for dehydration. So careful with elderly people, because they already are at risk for dehydration. Younger kids too. You always want to change the dose with any children. So check with a pediatrician. Generally,
before you start going out buying all these vitamins, and then you kill yourself from taking vitamins. You know, and the Corona didn't even have a chance because you killed yourself with vitamins.
That's right.
So,
about vitamin D. If you live in the northern states, like you primarily get your vitamin D from the sun, but be careful. A, D, E, and K, all those fat soluble, they can build up in toxic levels. They build up in your liver. You make yourself sick. So you gotta talk to a professional. Okay.
Absolutely. And I'm glad that you always everything that you said. You know, you tell people to back it up with your physician. And,
Absolutely.
That's the most powerful advice that you could probably have given all day, because, after this goes up, I mean, people are just going to, want to run out and do certain things. Yeah. But, you've already said, hey, listen, make sure that, you do this under your doctor's care. Don't go out, especially if, you have health problems and you're already taking medicine. You're taking high blood pressure medicine. You're taking medicine for respiratory stuff, for diabetes. You don't want to go in and start, taking vitamins that are gonna disrupt the flow of the medicine that you're taking for your ailment.
People that are diabetics and they're taking metformin in particular. Metformin already can lower your pH, so you have to be very careful. People that have coexisting comorbid medical conditions, I cannot stress enough to just be in contact with your physician. Have this conversation with them. If you're have a list of supplements and you're like, hey, tell me how I can use these, talk to them first, because they will know your medical history.
Absolutely.
Inside and out. They'll know your medications. Be careful with medications if you're taking medications. And health department, anybody that's symptomatic or you want to test, Adrian, I know you went to a place over in Hoboken, right? Call your health department. They'll know testing sites. Like you said, be your own best advocate.
Be proactive in this thing. Don't sit back and oh, I'm a victim of circumstance. If you really feel like you need to be tested, the first thing that they're going to say to you is, what are your symptoms? Well, your symptom, you don't sound like you have it. What do you mean I don't sound like I don't have it? I don't normally run a fever, but I also don't normally get short of breath either. So like, where are you coming from with this? And I think that, the shortness of breath was the thing for me with, my way into the door. And I went to the emergency room 2 times, and so because I was proactive in my situation, and then when I'm actually sitting and talking to the primary care doctor, okay, well, damn, she went to the emergency room 2 times. We really need to speak to her situation. But if you sit back and you sit back and you sit back and you let yourself get sicker and you get sicker, and then then now all of a sudden, you're trying to get help, people are going to be like, okay, well, maybe it's just your allergies or whatever. But I had stuff to back it up, because for a month, I was like really proactive in my situation. As soon as I felt something, I was like, yo, man, after the season was over, you're running around as a coach, and then, the season was over, on a Tuesday, on a Friday, I decided that I was just going to chill out. I wake up Saturday, I'm like, yeah, I was tired, but shit, this ain't no normal tired. But see, if I wasn't in tune with my body, I would have never known that it wasn't a normal tired.
That's right. Pay attention to symptomology. If you're not feeling well, and this is what I'm telling people, avoid the ER if you can. But if you are not breathing well and you're having difficulty breathing, you go. If it's an emergency, you go. There are urgent cares taking patients that you can go and be checked out. If they feel like you need emergent, ER attention, they're going to send you there. You can just about reach any one of your doctors here in Georgia. I can't speak for other places. Telemedically, a lot of employment places are setting up. I'm going to give a shout out to an app that I used with a lot of the Medicaid patients that I worked with down here. It's called My Ideal Doc. I am in no way affiliated with that. I in no way get any monetary reimbursement for that. My Ideal Doctor, the app. Download it on your phone. If you have insurance, Medicaid, you punch in your insurance number, you can be connected just like this with a doctor, and he can evaluate you right there and makes decisions based on your symptoms.
Absolutely. And that's exactly what I did. I utilized the number that I got from the National Basketball Retired Players Association. They gave us locations in Pennsylvania, New York, and New Jersey. Some would drive up, and then some places weren't. I didn't entertain anything that wasn't drive up because I wasn't trying to sit nowhere. I went over to the hospital, Riverside emergency room, and when I walked in there, I said, oh, hell no. And I went right back across the street to the drive-through people. I said, what do I have to do to become a patient of yours? And they were like, you got to fill this out. I was talking to the girl on the phone. Before I even got home, I had half my paperwork done. And then I went online and did the rest of it. Yeah. And then by the time I did the rest of it, they set me up for an appointment. The doctor called me that same day, a couple of hours later. And then my whole world changed after that, because I'd be damned if I'm going to be walking around trying to catch my breath and feeling like, I'm like, yo, I'm a former pro athlete. This ain't normal. So, the more proactive you are in your situation, the better. So, like I said, Nurse Jackie, I love you. You know what it is. You know what time it is. Vid, if there's anything that you'd like to ask or anything you'd like to say to wrap it up, I'd love to see you.
I don't think I answered his question about playing outside, park, bicycle ride, and things like that. This is what I'll say. If you can keep social distancing, that's fine. If you're bike riding and it's just you and you're not in a highly dense populated area, it's just you bike the road, that's fine. Healthy things you can do: eat right, eat a balanced diet, fruits and vegetables, drink plenty of fluids, get rest. Adrienne told me she wasn't sleeping for 8 days. When we don't sleep, we run our immune system down. So people, sleep. I know it's a high anxiety time. Yoga, practice meditation. Find something that you can do to relax your mind. Another thing, plug for my social work friends. If you're struggling with this, reach out to people. If you got an EAP program, talk to somebody. If you got a lot of anxiety going on, talk to somebody. Don't just keep it in, keep it to yourself. I think everybody, if you didn't have some fear, it wouldn't be normal. So a certain amount of fear motivates us to change, right? So we want to keep that fear in check and take that fear and turn it into knowledge, and that knowledge becomes action, right? And so if your kids are out playing, I would not let your kids play with other kids right now until these guidelines are lifted. I just wouldn't. If I had children, I would not do that. They can play with each other if they're in their backyard. If you take them to a park where there's not other kids playing, I would do that, but if you're going to be compacted with other people in parks, I would avoid it right now. I walk and bike ride, but I do it by myself. So. Absolutely.
It is what it is, Nurse Jackie. And like I said, I really appreciate you. It's mad love for you and Vid.
Had me on.
I just want to thank both of you. women power first and foremost. You know, getting
You
this,
better say it.
this for two intelligent women, and thank you both. You know, for asking the questions and answering the questions that most of us have and are afraid to ask.
Yeah.
So thank you both.
You're welcome. And just because you're Adrian's nephew, I do want to tell you I'm the only one that could do your aunt up back in the day. Don't let her lie to you.
Do that, she did. She tried to do a little something. That's white chocolate over there. She had some game, man. I wish her knees hadn't gave out on her, boy, because she definitely would have played in the WNBA, no doubt.
That's right.
No doubt.
Me too. I'd have had to follow you though, Quinn.
That's all right. I pick you up anytime. You was my first round pick.
That's right. That's right.
All right, ODU in the house, y'all.
Okay.
I'll talk to you off the cuff, man.
All right, man. Y'all have a good night.
You
all right.
too.
Bye-bye.
Be blessed.